We believe we're pretty unique as a medical practice, actually having command and some level of control and knowledge of the actual stem cells that we use. We make sure that the treatments are medically appropriate and necessary.
Stem cell therapy is advertised very heavily outside of the country, and in some cases people feel that they may get a better price. We feel that some of the risks related to going outside the country may outweigh the benefits.
The numbers of total cells, the numbers of viable cells, and the percentage, which is typically at least 95% of our stem cell vials, and nobody can represent anything greater than that.
We have Kendall here serving as one of our models. He can tell you direct testimony on what stem cell therapy has done for him.
So our pricing is extremely competitive. Treatments start at a few $1,000s and go up to a few more thousand.
I know Kendall because I've met him before and they have a beautiful practice. I just met Dr. Abe today, so nice to meet you and thanks for coming.
Thank you. Thank you for having us here today.
Yeah.
We're really excited to tell you more about our practice and how regenerative medicine is making a difference in patients' lives.
Please start with that.
So at ReimageMD, we focus on regenerative medicine with a special interest in stem cell therapy, particularly umbilical cord-derived stem cells that are processed here in the United States. Of a particular interest are the mesenchymal stem cells. These are cells that have a key role in reducing inflammation, in modulating the immune system, supporting repair, and also in regeneration. These cells do work in conjunction with other cells in order to optimize the potential benefits we see with our therapies.
Mm-hmm. Wow. So these are MSCs.
We do have a collection of MSCs that we use, but they are in conjunction with other cells as well.
Okay. And I hear they have great healing properties. Right, Kendall?
Yes. So that is the general theory behind stem cell therapy. We actually have a special affiliate relationship with a laboratory here in Irvine. I'm also an executive at that lab. So one of the true unique benefits that ReimageMD has is that we actually know where our stem cells come from. We know the history of the donors. We know the process. We know how they're stored. We know the purity levels and the percentage of live cells. So we are not just buying our product from a salesperson who sells everything. We actually know where our cells come from, and even as far as transporting them at the appropriate temperature, storing them at minus 80 degrees Celsius in our office. So we believe we're pretty unique as a medical practice, actually having command and some level of control and knowledge of the actual stem cells that we use, in addition to our high level of expertise in the actual administration. I think the other thing in this stem cell space is we are a true medical practice. We are not an injection shop. We don't sell a commodity. We're not a nail salon where, oh, hey, you can get stem cell injection as well. Mm-hmm. We actually treat our patients. We do a full workup on our patients. We do in-depth consultation. We make sure that the treatments are medically appropriate and necessary. So that's what we offer. Top quality product. Our lab ships all over the world. Our product is, we believe, the top quality product on the planet. And I think our medical protocols are unparalleled.
Yeah, I think you just answered my next question, which was going to be what makes you unique and superior, aside from a really good quality lab, quality products, and a nice facility here nearby, Newport, right?
Our facility is beautiful. But I do think the medical protocols and the care we take in how we approach our patients, because I mean, it's not, there's only a few things that, you really have to watch out for, but most of them have to do with the condition of your patient. And then obviously whether your product is superior and whether it's not contaminated.
So we definitely put a lot of emphasis in vetting out the companies we work with. in terms of where we get our stem cells. So we do work with a lot of high quality medical providers, and we do take a personalized approach to our patients. So we do customize treatments based on the diverse needs of our patients. And with our wide network of medical providers, we can provide comprehensive care.
Yeah. So it's more personalized treatment.
Absolutely.
Okay. And then what types of conditions do you treat? And depending on the condition, what type of treatments do you offer?
So I'll go ahead and go first. There's really 4 categories of stem cell treatments that we provide. The first is general IV treatment, which is typically combined with exosomes as well. And that is for general health and wellness. Some people say beauty, but a general overall feeling of well-being and promotion of longevity and that sort of a thing. I've had the treatment twice. I've experienced amazing results. Can't tell if I'm living longer yet, but I feel like I will. Number 2, IVs to treat certain medical conditions, and Dr. Abe can speak a little bit more in depth to those, but generally autoimmune issues and the general anti-inflammatory properties. We believe, or we have, noted from the research that the cells tend to find the areas of your body that do need help, even in a generalized IV. Category number 3 would be direct injections to certain areas of the body. That typically is joints, muscles, and even spinal to treat certain neuro conditions under protocols that have been developed, primarily in other countries. Number 4 are direct injections for cosmetic purposes. It can be hair restoration. I've had 2 treatments. And as well as for facial rejuvenation. We're finding that a lot of we're getting a lot more female patients for the hair restoration than we expected.
Wow.
And there seems to be a demand for that, as well as the facial injections. Again, a lot of practices will use exosomes primarily for those treatments. We have found that stem cells are more effective, although we do administer exosome treatments, and sometimes in combination.
Yeah, I like the combo of both.
But in terms of what we actually, the conditions that we treat, I mean, we do not make direct claims for any types of cures or really, types of conditions that can be helped. I mean, what we can do is we can look at how our patients have performed, the testimonials of our patients, the research that's being done in clinical trials in universities all over the world, as well as certain treatments that have been approved by ministries of health of other countries. For instance, Japan and South Korea have approved spinal injections to deal with issues such as Alzheimer's, Parkinson's, even autism, types of neuro conditions. But because of the restrictions in the United States and the fact that stem cell treatment is considered experimental and investigational from a medical practitioner standpoint, we are careful as to what claims we make.
You do the spinal injections also?
We do spinal injections as well.
Okay.
Primarily to help with patients with back pain or neurological conditions. However, as Kendall mentioned, we don't make any claims as to the cure or treatments that we provide, but we have the ability to do it all.
And this is all done at your location there?
So occasionally, if we have to bring in specialists that require certain types of imaging or anesthesia, we will go to a surgery center.
Yeah.
But any treatments that require naked injection or use of ultrasound, we can do in our facility.
Yeah. Yeah. Wow. Okay. So do you know, Dr. Abe, why patients are going out of the country for this type of treatment?
There is some hesitation with a lot of providers here in the United States to provide stem cell therapy. Stem cell therapy is advertised very heavily outside of the country. And In some cases, people feel that they may get a better price, and Kendall will talk more about that later. We feel that some of the risks related to going outside the country may outweigh the benefits. One of the concerns of stem cell treatments is that the cells are not multiplied, cloned, replicated. There are different terms people use, but basically that means having a collection of cells and then in the lab multiplying them to now have a larger quantity of cells. This replication or multiple generation of cells, unfortunately, increases your risk to get bad cells.
I see.
And there is a perception that because of the rigorous regulation in the United States, that you can only get the good stuff if you go out of the country. And that is simply not factual. Again, going back to the quality of the cells, that we have full knowledge of their efficacy and potency because of our relationship with the lab. We believe we have the highest quality cells on the planet, and that some of these tricks that are utilized by laboratories, many of the clinics out of the country actually have their own lab, which is sort of a frowned on relationship here in the United States. There's a lot of tricks being played and marketing techniques used. And there's a lot of publicity. There's a lot of professional athletes that go out of the country. We're trying to get them to come here. It's convenient. We have U.S. doctors, Harvard-educated doctors. We have all the protections that you would normally receive when getting any type of service or buying any product in the United States,
and not have to go out of the country.
Here. But there is a lot of marketing with these out of the country situations, and oftentimes their pricing is in excess of what we charge.
Yeah. Correct me if I'm wrong, but I believe I hear a lot of patients talking, and the reason why they go out of the country is not just because it's heavily marketed, but they make really big promises, like millions and millions of cells, and obviously they're culturing in their own laboratory. And the reason why anyone would prefer to go to Dr. Abe or Kendall versus Mexico is because with the lab that they're working with here, there's FDA regulations that we adhere to here in the United States or on this side of the border, versus in Mexico, they have no regulation. So who knows what their culture process is? And here in United States, it's FDA requires minimal manipulation, so we can't manipulate cells. So that's why it's safer, and that's why it's better to use a doctor here on this side of the border versus Mexico, in my opinion.
That is absolutely correct, and I couldn't have stated it better. Well, maybe I could have.
Yes, of course.
You were very close.
Yeah.
And we actually do represent the number of cells because our lab actually produces those reports for every batch of cells we create. And so,
the reports are transparent.
The numbers of total cells, the numbers of viable cells, and the percentage, which is typically at least 95% of our stem cell vials, and nobody can represent anything greater than that. In fact, a lot of competing labs, both in and out of the country, have even gotten away from representing numbers of cells at all.
Yeah.
And we've often tested some of these competing vials to see, do they really have anything in them? Some of them have zero.
Yeah.
Zero stem cells, or they will have stem cells, but they're mostly dead, or they'll state that they have 10 million when they only have 200,000. So numbers are important, and so forth. So
well, what's good about your cells is it comes with a certificate of analysis.
They definitely come with a certificate of analysis, and and 4 levels of tests. And again, one of the key issues with stem cells is safety. It's safety and quality, and this is why there has been so much regulation and scrutiny, because the issue of bacteria and sterility is the thing that can cause patients harm. So again, the process, the testing, 4 levels of testing from the lab, and then the storage and the transport. I mean, any break in that, in the protocol can cause issues.
Yeah.
Or at best, it'll mean that you have fewer viable cells, which isn't going to hurt you, but you aren't getting what you paid for.
Yeah.
And at worst, contamination and inefficiency. So,
Dr. Abe, do you have a success story that you can share with us?
Wasn't planning for that one.
Patient feedback,
So
maybe yourself. Have you tried?
Kendall.
Kendall's tried it.
So fortunately, we have Kendall here serving as one of our models, and he can tell you direct testimony on what stem cell therapy has done for him.
Yeah.
Yeah, and
I do it every year.
Oh, excellent.
Great
Excellent.
stuff.
Well, we'll have to have you at our clinic the
Yes.
next time you do it, because
Thank you.
So we have had some patient success stories. I mean, we treated a gentleman with pulmonary fibrosis who did experience relief almost immediately. Again, it's an incurable disease, and it is degenerative, is my understanding.
So yes, pulmonary fibrosis is a very difficult condition to treat. We did use stem cell therapy for him.
Infusion or?
We did IV.
Okay.
IV infusion, correct. And so he did receive a benefit. He was also on steroids. Steroids and stem cells do not necessarily go well with each other. And so weaning him off steroids in order to give him stem cells was a little bit of a challenge. But working with our team and finding the balance of when to administer the stem cells was helpful.
Yeah. So there is an interaction with steroids and.
So steroids and stem cells don't go well with each other, just in general.
Good to know.
In our pre-treatment instructions, we do have a list of things, and it's mostly NSAIDs and steroids that you need to get off of. But
that's good to know.
We do review every patient's medications and so forth. And again, one of the things that I know Dr. Abe was going to mention is that we do not, I would say, probably ever intervene or try to contradict the recommendations of the Western doctor that is treating these patients.
Yeah. So as we mentioned, stem cells are still considered largely investigational. And so it's very important that patients do follow the recommendations of their providers. We could look at the research and see where we can help, and many times we can. And finding that balance of coordination is important.
Okay.
But I would just say in general, in the patients that we've treated, virtually everyone has experienced some benefit. I think we've had one that felt like it didn't really do anything for them. But what we've noticed almost universally is regulation of sleep patterns. And people notice that immediately. And again, with the proper dosage, I know my first dosage, I immediately went from sleeping maybe 3 or 4 hours a night to 7.5, 8.
So it's good for insomnia.
It is stuck there with me. Absolutely.
Wow.
And again, for me personally, my blood pressure has always been a little elevated, and it's maintained at a rock solid, 120/80, 110/70. So those are the two things I've noticed. Also mood elevation, and I'd say mental acuity.
Wow. Did you experience pain and inflammation before your treatment?
I really didn't. No, I didn't really have any issues.
Okay. Well, my husband and I did it for pain and injury. So he plays soccer and we both played pickleball, and I had an ACL tear. So did he. And he had plantar fasciitis. Am I saying that right?
You are? Very good.
So we did direct injections. We did IV infusion. I literally was walking in heels within 24 hours, pain gone. And, that doesn't happen for everybody. And I'm glad it helped us. So we continue to do it every year. because not only is it preventative, elective, but it's also, I feel like it's good for anti-aging too.
And yeah, that's one of the terms I haven't thrown out yet. But for the IV, when we say wellness, general health, and so forth, anti-aging is the other buzzword that a lot of people come to us for. I think the proof is going to be in actually measuring that at some point. But for a lot of these benefits, for me, I felt the effect. The first IV I got, within 2 hours, I felt this buzz through my body, this general feeling that something was energizing my cells in my body. A second time, immediately. But some people don't feel it for days or even a week. Some of the effects, like for the hair restoration, I don't feel like it really kicked in till about 6 or 7 months.
Oh, wow. Okay.
And I'm told that is probably what you should expect.
Okay.
I love experimenting on myself. I'm going to do my knee and my ankle next. I've been in a couple of bad accidents where I was hit as a pedestrian.
Hey,
And I
might
have
as well.
lots of metal. And
He can be your guinea pig,
He
Dr.
can't.
Abe.
no,
He already is.
Have you tried it?
I have not tried it yet.
Okay, so that's good. No injuries so far.
I have been lucky.
No ailments, so you're lucky.
And no, he hasn't tried the hair restoration either.
I've tried it multiple times.
So he is not a representative
No.
one way or the other on that treatment.
I see. So for those clients that are out there that are wondering, and this is all foreign to them, what is the price range that they can expect for these kinds of treatments?
So our pricing is extremely competitive. Treatments start at a few $1,000s and go up to a few more thousand. I generally handle the pricing for most of our. We start with with guidelines. But what we truly, I am willing to generally match any price out there if it's truly apples to apples. But a lot of times when people say, oh, I got quoted a certain price, it's really not the same treatment.
Yeah.
But if we're talking about the same quantity of cells, the same, level of skill and so forth, I'm happy to match or even beat in any pricing out there. But,
So it probably starts with a consult.
It absolutely starts with a consult. And to be honest, we haven't lost any patient that has come for a consult has gotten the treatment.
Nice.
So we're, I guess, pretty convincing.
Yeah.
But I think for the right reasons, I think people sense that we know what we're doing and that we're very fair. And one of the we have treated people for no charge either.
Wow, really?
And people who are truly in need, and we feel like we can help them. I mean, it's not how we make our living. We're also establishing a nonprofit organization too, which project has been on my desk.
Okay.
And so we're pretty excited about that too, because we feel like we can we can raise funds for that, and we can treat more people who really can potentially benefit from our treatments medically.
Okay.
So that's pretty exciting.
And any room for expansion, locations?
Yeah. So we have until very recently been in Malibu, and we elected to move from that location, and we are actually have been looking at a location in Pacific Palisades. Not sure when this is being broadcast, but both of those locations have had some real issues with the wildfires in the last couple of days.
Yeah.
And we also have access to a facility in Beverly Hills that we can use. And one in North County, San Diego. But we are opening a clinic in the Philippines with an affiliate that we've done business with for a while with the lab.
Mm-hmm.
That's happening very immediately. We've looked at Hong Kong for a few months now, and we're either going to do Hong Kong and mainland China, or both, and also Dubai. So, and we are willing, for anybody in the Southern California region. I mean, we are willing to provide transportation, even lodging in certain circumstances, to what makes sense. And depending on the treatment, I mean, we'll bring people in from anywhere in the States. It's all
Wow. Okay.
it's all part of the deal. So, but we established our Newport Beach office a couple of years ago, and we're really happy with how that came out and its location. We're right on the marina, right on the water in Newport Beach.
It's a beautiful clinic.
Actually 0.4 miles from this studio.
Yeah.
But we didn't walk. But yeah, we're very happy about where things are going.
Okay. And if they have any questions for you specifically, Kendall or Dr. Abe, where can they reach you?
So our website is ReimageMD.com. Our Newport Beach number is 949-614-0390. You can email me personally at kpaulson, Paulson, at ReimageMD.com, or mail info at the same domain. And generally, I am the one that can answer a lot of questions. If they get very technical, we'll bring in Abe or one of our other doctors to answer some questions. But I've gotten pretty good at fielding most of the questions. But to make an appointment, call our number, send an email. There's access on the website as well, I think, to send your information. So we're very open to talking to people and hopefully making your lives better.
Yeah, I'm so excited for you guys to get a consult with them and take a look at their facility. It's beautiful. It's 0.4 miles from here, Newport Beach. Dr. Abe, thank you. It was a pleasure meeting you. Thank you for taking time out of your busy schedules to be here today. We'll hope to see you soon, and maybe we'll come back and you give us more testimonials, because I know you guys are really busy. And one question. Somebody wanted me to ask you if you treat veterans.
Yeah, we would definitely like to work with some veterans organizations. That's one area that we haven't explored. We have talked to some of the firefighters organizations, which again is becoming relevant again.
Okay.
But
that's good to know.
Yeah, these types of organizations that have, repeat people that have, certain categories of suffering, we would certainly like to work with more.
Perfect. Thank you again for coming.
Thank you, Eloisa.
Thank you.
It's just such a pleasure.
Thank you.